You're sitting at the table having breakfast. Everything is normal. You pick up your coffee mug. Suddenly your hand drops the cup. You try to speak, but the words don't come out right. Your face feels strange. One side of your body stops responding. In seconds, your life changes completely. And the worst part, you don't even understand what's happening. This is a stroke, and it can happen to anyone at any moment without warning. Every year, more than 795,000 Americans suffer a stroke. It's the fifth leading cause of death in the United States and the #1 cause of serious long-term disability. Think about that. Not cancer, not car accidents. Stroke is what leaves most people unable to walk, talk, work, or live normally. But here's the truth that almost nobody tells you. There's a window of time where it's possible to reverse a stroke. A window where doctors can literally stop the destruction of your brain and bring you back. But that window closes fast, very fast. And you who are watching me now need to know exactly what to do when this happens to someone next to you. Because the chance of survival and recovery doesn't just depend on the doctor, it depends on you. My name is Kenji Oshiro, and if you're not subscribed to the channel yet, subscribe now because this video can save your life or the life of someone you love. I'm going to show you exactly what happens in the brain during a stroke, how to recognize the signs in less than 30 seconds, and what are the modern treatments that can literally pull the clot out of the brain and reverse paralysis. Yes, you heard that right. Reverse. But first of all, you need to understand the enemy. What happens when blood flow to a part of the brain is interrupted, and without blood, there's no oxygen. Without oxygen, neurons start to die, and they die fast. Did you know that the brain uses 20% of all the oxygen in your body? 20%. And it only weighs about 3 pounds. It's a powerful machine, but extremely fragile. Neurons can't survive more than 4 minutes without oxygen. 4 minutes. During a stroke, every minute that passes, about 1,900,000 neurons die. 1,900,000 every 60 seconds. That's why doctors say, time is brain. There are two main types of stroke. The first, and most common, is ischemic stroke. It represents 85% of all cases. What happens? An artery in the brain gets blocked by a clot. It can be a clot that formed right there or that came from another part of the body, usually from the heart. When that clot blocks the passage of blood, the entire area of the brain that depended on that artery starts to die. The second type is hemorrhagic stroke. It's less common but more deadly. It represents 15% of cases. Here it's not a blockage, it's a rupture. An artery inside the brain bursts. Blood leaks into the skull, pressing and destroying brain tissue. Often this happens because of an aneurysm. And here's something that's going to scare you. 1 in every 50 people has a brain aneurysm and doesn't know it. 1 in 50. You could be walking around right now with a time bomb inside your head and have no idea. But let's focus on ischemic stroke because it's the most common and the one that has the best chance of being reversed if treated quickly. Let me tell you the story of Robert Mitchell. Robert was 52 years old. He worked as a sales manager. Busy life, high stress, but nothing out of the ordinary. One Tuesday morning, he was at the office answering emails. Suddenly, he tried to grab his pen and his right hand didn't obey. He looked at his hand as if it wasn't his. He tried to speak to the colleague next to him, but the words came out slurred, confused. The right side of his face started to droop. Robert's colleague immediately noticed that something was very wrong. She didn't know exactly what, but she knew she had to act fast. She called 911 right away. Didn't wait to see if it would get better. Didn't try to give water or medicine. Called immediately. That action saved Robert's life. Because while the ambulance was coming, every second counted. Inside Robert's brain, millions of neurons were dying. The area responsible for movement on the right side of the body and for speech was being destroyed. But there was still time. There was still a window. The ambulance arrived in 8 minutes. The paramedics did a quick assessment, confirmed the signs of stroke, notified the hospital they were bringing a patient with suspected stroke. The hospital activated the emergency protocol. When Robert arrived, the team was already waiting. CT scan done in minutes. Confirmed ischemic stroke. Clot blocking the left middle cerebral artery. The doctor quickly explained to Robert's wife, who had just arrived, There's a medication that can dissolve the clot, but it only works if given in the first 4.5 hours. Robert was inside the window. Barely. They administered the medication. It's called TPA, or tissue plasminogen activator. It's a clot dissolver, intravenous, straight into the vein, and then the modern miracle began. While the medication entered Robert's body, his wife held his hand and cried. Robert still couldn't speak properly. His arm was still weak. But about 20 minutes after the infusion started, something incredible happened. Robert started to move the fingers of his right hand. Slowly. First one finger, then another. His wife saw it and started screaming with joy. 5 minutes later, Robert was able to lift his arm. And then, with his voice still a little slurred but clear, he said, "I'm okay." The clot was dissolving. Blood was flowing back. The neurons that were still alive but suffering started to recover. Robert was lucky, very lucky. But most people don't have that luck. You know why? Because they delay asking for help, because they think it will pass, because they don't know how to recognize the signs, because they miss the window. And when the window closes, there's no going back. Now you already understand what a stroke is and why it's so devastating. But the question that really matters is, how do you recognize a stroke in someone? How do you know you need to act immediately? Because the problem isn't just the stroke itself. The problem is that most people don't realize a stroke is happening. They think it's tiredness. They think it's high blood pressure. They think it will pass. And while they think, the brain is dying. There's a method you need to engrave in your head right now. It's called FAST. It's an acronym used worldwide to detect stroke in seconds, 30 seconds. That's how long it takes you to do this test. FAST means face, arms, speech, time. I'll explain each one. F for face. Ask the person to smile. If one side of the face doesn't lift, if the smile is crooked, if it looks like one side of the face melted, it's a stroke. Red flag. A for arms. Ask the person to raise both arms at the same time and hold them in the air. If one of the arms falls, if they can't lift one side, if one arm is lower than the other, it's a stroke. Red flag. S for speech. Ask the person to repeat a simple sentence. Any sentence. Like, the sky is blue. If the speech comes out slurred, confused, if they can't speak properly, if the words come out garbled or wrong, it's a stroke. Red flag. T for time. If you saw any of these signs, any one of them, it doesn't matter if it's just one, you call 911 immediately. Don't wait. Don't give water. Don't give medicine. Don't lay the person down. Call. Now. Time is brain. Every minute you lose, millions of neurons die, and they don't come back. But there's more. The FAST method is excellent, but there are 2 additional signs that many people ignore. That's why some countries use an expanded version called B-FAST. Same idea, but with 2 extra signs that increase detection even more. B for balance. The person suddenly loses balance, walks crooked, looks drunk, stumbles for no reason. This can be a stroke affecting the cerebellum, the part of the brain that controls balance and coordination. E for eyes. Vision. The person suddenly has double vision, loses vision on one side, or can't see half the visual field. Many people ignore this, think it's just dizziness, but it's a classic sign of stroke. So recap: crooked smile, dropped arm, slurred speech, loss of balance, vision problem. Any of these signs, you act. And here's something many people do wrong. Never give aspirin to someone with suspected stroke before getting to the hospital. Never. Aspirin works for heart attacks because it thins the blood and helps dissolve clots in the heart. But in stroke, you don't know if it's ischemic or hemorrhagic. If it's hemorrhagic, meaning there's bleeding in the brain, aspirin will make everything worse. It will increase the bleeding. It can kill the person. So don't give anything, just call for help. Now I'm going to tell you another story. The story of Margaret Thompson. Margaret was 73 years old. Widow, lived alone. One night she went to sleep feeling fine. She woke up the next morning and couldn't move the right side of her body. She tried to scream for help, but her voice didn't come out right. She was desperate but conscious. She knew something was terribly wrong. Margaret managed with great effort to grab the phone with her left hand and dial 911. She managed to say a few words, but it was enough. The ambulance arrived. They took her to the hospital. Here's the problem. Nobody knew when Margaret's stroke had started. She went to sleep fine, woke up bad. It could have happened at 2 in the morning, at 4, at 6. Nobody knows. And if the stroke happened more than 4.5 hours ago, TPA can't be used. It's too risky. It can cause bleeding. Margaret was outside the TPA window. Many hospitals would have said, "There's nothing we can do except observe and rehabilitate later." But the hospital where Margaret was had a newer technology, a technique that can work up to 24 hours after symptom onset. It's called mechanical thrombectomy, and that's what saved Margaret. Mechanical thrombectomy is this. Instead of dissolving the clot with medicine, doctors literally fish the clot out of the brain. How? They make a small incision in the patient's groin. They insert a thin catheter the size of a strand of spaghetti through the femoral artery. They guide that catheter upward, passing through the abdomen, through the chest, through the neck, until it reaches inside the brain's arteries, all guided by X-ray in real time. When the catheter reaches the clot, they open a small metal mesh, like a cage, inside the clot. That mesh traps the clot. And then, slowly, they pull the catheter back. And the clot comes with it. Whole. Out. Sounds like science fiction, but it's real. And it works. Margaret underwent thrombectomy. The procedure lasted about an hour. When it was over, she could already move her right-hand fingers slightly. A few hours later, she could lift her arm. The next day, she was speaking better. In a week, she was walking with help. In a month, she went home walking on her own. Margaret was lucky. She had access to a hospital with infrastructure. She had a trained team, and she had someone who recognized the signs and called 911 quickly. But 70% of people who suffer a stroke don't have that luck. 70% are left with permanent sequelae. Many never walk again. Many never speak properly again. Many become dependent on care for the rest of their lives. Why? Because they arrived late. Because nobody recognized the signs, because they missed the window. So let me ask you a question. Would you know how to recognize a stroke in someone next to you? Now you know. And that knowledge can save lives. Let's talk now about what happens afterward, because even with quick treatment, many people have sequelae. And it's important for you to know what to expect, what can be done, and when it's time to seek additional help. The brain is incredible. It has a capacity called neuroplasticity. It means that healthy neurons can, with time and training, take over functions of neurons that were lost. But this doesn't happen by itself. It needs rehabilitation. It needs physical therapy, speech therapy, occupational therapy. It needs effort. And the sooner rehabilitation starts, the better the results. Many people think, I'll wait for the body to recover on its own. Wrong. The brain needs to be stimulated. It needs to relearn movements. It needs to reconnect neural pathways. And this only happens with repeated, constant, guided practice. People who start physical therapy still in the hospital, sometimes the day after the stroke, have much better recovery than people who wait weeks or months. But one thing needs to be clear: stroke is not an isolated event. Whoever had a stroke has a much higher risk of having another one. About 1 in 4 people who survive a stroke will have a second stroke in the next 5 years. That's why it's essential to control risk factors. What are they? High blood pressure is number 1. Hypertension is responsible for about half of all strokes. If your blood pressure is high, you're at risk. You need to treat it. Diabetes also greatly increases risk. High cholesterol. Atrial fibrillation, which is a type of cardiac arrhythmia that causes blood to form clots in the heart. Obesity, sedentary lifestyle, smoking, and family history. If you have any of these factors, you need to be alert. You need medical follow-up. You need to measure your blood pressure regularly. You need to take prescribed medications. It's not exaggeration, it's prevention that saves lives. And there's another important thing: warning signs. Often before a major stroke, the person has small strokes called transient ischemic attacks, or TIA. These are strokes that last a few minutes and then the symptoms disappear completely. The person thinks, oh, it passed, everything's fine. But it's not. A TIA is a warning. It's the body saying, something is wrong. If you had a TIA and didn't seek help, your risk of having a complete stroke in the next days or weeks is extremely high. That's why, even if the symptoms have passed, seek a doctor immediately. Other warning signs that should never be ignored. Sudden and intense headache, the worst of your life with no apparent cause. It could be a hemorrhagic stroke starting. Sudden mental confusion. Difficulty understanding what people are saying. Intense dizziness with vomiting. Loss of consciousness. Any of these signs needs urgent medical evaluation. Now I'm going to give you a practical plan. What to do starting today to reduce your risk of stroke. First week, schedule a medical appointment. Ask to measure your blood pressure. Ask for cholesterol and blood glucose tests. Know your numbers. If they're abnormal, start treatment. Second week, start moving. It doesn't have to be the gym. 30 minutes of walking a day already significantly reduces stroke risk. Every day, no exceptions. Third week, improve your diet. Reduce salt. Increase vegetables, fruits, whole grains. Avoid ultra-processed foods. The brain thanks you. And from then on, maintain. Blood pressure control, physical activity, balanced diet, don't smoke, moderate alcohol, adequate sleep, stress control. Seems simple, but it's powerful. About 80% of strokes can be prevented with lifestyle changes and risk factor control. 80% here. But if it happens anyway, now you know what to do. Recognize the signs, act fast, call 911, don't hesitate, don't wait, time is brain. Modern treatments are incredible. TPA can dissolve clots, thrombectomy can pull clots out, but all of this only works if you get there in time, and who gets you there in time isn't the doctor, it's you. It's the person next to you who recognizes the signs and acts. Robert went back to work 3 months after the stroke. He has a slight weakness in his right arm but lives normally. Margaret went back to her home, takes care of her garden, plays cards with her friends. Both had second chances because someone acted quickly. And you? Are you prepared to act if you need to? Now you are. Keep these signs in your head. Fast. Be fast. Face, arms, speech, balance, vision. Any sudden change, you act. And remember, stroke doesn't warn, doesn't ask permission, doesn't wait for the right moment. It just happens. But now you have the knowledge, and knowledge saves lives. So answer me here in the comments. Have you ever witnessed someone having a stroke? How was it? And from what place in the world are you watching this video? If this content was useful to you, leave your like, share it with someone who needs to see this, subscribe to the channel if you're not subscribed yet, and activate the bell to not miss the next videos. Take care of your brain. Take care of those you love. And remember, time is brain.